Good morning, Scarlett. My name is Shane McMillan, one of the nurses working in this ward. How are you feeling now?
Good morning, Shane. I'm all right. Thank you for asking.
Good to hear that. Well, I can see you are concerned. May I know the reason behind that?
Actually, nurse, I anticipated that I would be discharged from the hospital within 2 to 3 hours. Suddenly I realize not only that I have had a fright, but also asthma attack. Moreover, I have never had an asthma attack before.
I realize your concerns. Try not to worry, Scarlett. You will be all right. At present, you are under observation. Afterwards you will be discharged. By the way, do you have any questions regarding asthma?
I just know little about asthma. Can you please explain to me about asthma?
Of course, I will. Asthma is a chronic disease which affects the airways. In this condition, a person's airways will become inflamed, narrow and swell, and produce extra mucus, which makes it difficult to breathe, and trigger coughing, a whistling sound or wheezing, when you breathe out, and shortness of breath.
Okay, I got it. And I wonder how it is caused.
I appreciate your consciousness. Surely, I will explain the causes of asthma in detail. Exposure to various irritants and substances that trigger allergies can trigger signs and symptoms of asthma. It is important to note that asthma triggers are different from person to person.
All right, I understand that.
That's perfect. Some of the environmental causes include airborne allergens, such as pollen, dust, etc., respiratory infections, like the common cold, or due to cold air pollutants, etc.
Okay.
Other causes can be physical activity, strong emotions and stress, influence of certain medications, as well as gastroesophageal reflux disease, in which the stomach acids back up into your throat.
All right.
In addition, your inherited genetic makeup predisposes you to having asthma. It's a true fact that, if a person has a parent with asthma, they are 3 to 6 times more likely to develop asthma.
So, there are many causes that trigger asthma.
Yes, Scarlett, you are right.
Nurse, I have even heard stories about people dying from asthma attacks.
I acknowledge your words. Although asthma is considered a chronic disease, the large majority of patients have good control of the disease, if prevention measures are applied, and the inhaled treatment is done correctly.
Oh, really?
Definitely, Scarlett.
Then nurse, how can it be treated?
Your question is reasonable. In this situation, the most effective way is to open the airways to breathe efficiently. The most common means is to use an inhaler, a Ventolin inhaler, that is, salbutamol.
Okay. But could you brief me how to use it?
It is easy to use as well. Shake the inhaler hard 10 to 15 times before each use. Then hold the inhaler with the mouthpiece down. Place your lips around the mouthpiece. As you start to slowly breathe in through your mouth, press down on the inhaler 1 time.
Okay.
Take the inhaler out of your mouth. If you can, hold your breath as you slowly count to 10. This lets the medicine reach deep into your lungs. After this, breathe out slowly through your mouth.
To be honest, I am quite anxious about the proposal to use a Ventolin inhaler. That is just because people have told me about its misuse.
Your anxiety is reasonable. I agree with what you have said. Even though the inhaler is being misused by some people, its therapeutic purpose cannot be neglected, especially for an asthmatic patient.
Yes, I understand what you have said. Well, I would like to know the long-term prospects now that I have had an asthma attack and been held in hospital overnight for observation.
It is a sensible question. Currently, you are being held in the hospital for observation purposes. After the complete assessment, and once you feel fine and settled, the doctor will discharge you. Thereafter, please follow the treatment protocol as per the doctor's advice, and take inhaler as prescribed, to avoid further recurrence.
Surely, nurse.
Moreover, I would like to reassure you that, if you manage the symptoms effectively, and follow doctor's instructions, asthma can be controlled to a greater extent, thereby reducing the chances of asthma attacks in the future. I hope it releases your anxiety.
Yes, Now I am a bit settled. Thank you for clarifying my doubts.
Glad to hear that. I wish you a speedy recovery.